Hey guys, it's your brother in Christ, Weston. Thanks for joining me today. Today we're going to be giving you a health update of all things that I've been experiencing going on. Let's get into it. Okay, so this video won't be long. What is it? Um, so yesterday I'll just go into it. Yesterday I went to my neurologist and we did a follow up on blood work for my brain. So when they found some findings in my brain, they found that I have a partial emptied cella. It's where your like pituitary gland sits. It's partially emptied. It's a common finding, supposedly. It's incidental, meaning as they were searching for something else, they found that. Then they found something I mentioned before. It's bilateral calcification on my basal ganglia. Not sure if that's what's causing some of my issues, because my issues were really more just onset after being sick. I'm not sure. Um, but what is it? Um, that's in the same area as like the substantia nigra, where dopamine is at, where your dopamine transmission where it operates at, and you can figure out. You can even see that area if you were to do something called like a DAT scan, DAT scan, to see how I guess like how your dopamine or how like they would put like a food coloring or something like that or some kind of coloring contrast to see how it goes into the substantia nigra to see how it like pushes out I guess or how it flows to see if you are having issues with dopamine transmission. You can see that that's not actually like something that can still diagnose anything. And they did blood work. We did four labs, and I mentioned this one for ammonia, one for calcium, one for manganese, and then one for it's called seroplasmine. And that may make sense to a lot of people, but it was because of like trying to see if there's any toxins in my body, if there was any like overabundance of something that was in my body for that could produce whatever's happening there. And they all came back clean. So they just chalked it up to, hey, this is normal. We're seeing you've seen this, you have this, okay. And this is most likely due to aging. It's nothing in your body that we can find that at least contributes to that. Don't know. I don't know if there's more testing. I have no idea. And then we did so that's one good report. Then we did a lower leg EMG, meaning from my hip, which is right here. If you can see my hand, it's boing right here, sitting down here. Okay. My hip all the way down. Okay. Um, they pretty much mentioned this before. It's like hooking up a car battery. They put it on certain nerves of the feet on the feet and on the legs. They take a prong. It's like a wand with two prongs on it. They have a gel. They start finding the nerves and they shock it. Well, the legs actually hurt a lot more. Um, they're not comfortable. I mean, like they're painful in a way, but they're all they're okay. I deal with pain, but they're just the arms are way different because it's easier voltage, it's less voltage, but with the leg or the limb, the leg it's a bigger muscle group, so they have to use a higher voltage to get the reaction they need to see. And so they did that, and both legs came back great. Then they did the needling where they test the actual like muscle. I think the motor neurons or how things are. I don't know. I don't know what the needling actually does. I think maybe that's what the nerve conducting. I think the nerves just to see if the nerves are good. Then the needling is to find out if it's speaking because you can hear it when you like when they'll have you like they'll put it like here. Okay, that's think of this as like my ankle in an area. Okay, and they will poke right there or they'll poke in a certain spot, then you have to do like the opposite. So if like they're poking here like right between your heel and your ankle, then they'll tell you like move your foot this way and it'll make a noise on this thing per the needling that's inside your foot, and it literally just pierces right through. It's like paper. And they did it in my leg, my ankle, my shin, my calf, my thigh. And it all came back great. So I've now done an upper EMG and a lower EMG. I have lately been experiencing what feels like an internal tremor of my calf. Now, I have looked up time and time again for like anything that I can find. I think I found one person online that said like they had Parkinson's and um, they started in their calf or whatever, but everybody that I can find says but they also had other things as well. I don't have anything. I don't have anything else that I can think of. But I've been having what feels like a rhythmic shaking in my calf, but it's not visible. It's internal. You cannot see it. I can't see it. So you can't see it. I can feel it. And It has just been like whoa, 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 whoa. And then when you move, it goes away, and then you stop and it comes back. But then it'll go away. Well, I did some PT yesterday, as I did last week as well, and I can't remember how long this has really been going on. And then I've been having a lot of tension in my leg, literally in my arch. I have little princess arches, so my arches are like this. They're like literally like that, like just like that, right? They're like that, right? And then big toes over here. Um, I'm not putting my feet on camera. Not letting the dogs out. What is it? And then I have like my Achilles has been super tight, super tender. My calf is really bad. Goodness gracious, when I go to PT and he's worked on it twice now, it is extremely painful. Just pressing. It's like, why is this so bad? Um, and then there's a spot in my thigh, like this my knees right here. There's a spot in my thigh that I can feel that has tension. There's a spot in my lower back and in my medial glutes, in the medium of my butt, pretty much right here, could be something called performance syndrome. Anyways, I have like a whole bunch of compromises on this side, and yesterday I just after my PT, my foot just felt super bad, and my heel felt really tender. My plantar fascia, which is the heel part of your arch, that's where your plantar fascia is. It just felt really bad. So have this little tool. It's a little like looks like a little roller. You just put your foot on it. It's fit to make your foot, and you just roll. You just roll it out, right? So you put it under, you put it on top of your foot on top of it. It's made to fit the groove of it, and then you just roll. And I just rolled it aggressively, and it started to relieve my symptoms and started to like take away this this what feels like an internal tremor or an internal vibration of my foot, which is of my calf, which is really really exciting because that tells me that something mechanical, something that's going on. Because if it was Parkinson's, it would always be on at rest, and it would take seconds to maybe I don't know, maybe less than a minute for sure that it would just start to kick on, right? And it doesn't do that. And so it was a really good day yesterday because I got really good news. It was like, hey, your brain structurally, you don't have MS. There's no lesions on your brain. You don't have MS. You don't have any strokes. Um, Everything sits. You don't have any masses, any tumors. They do not believe that I have Parkinson's. And I remember I kept telling you, I keep hearing the Holy Spirit say, you do not have Parkinson's. You do not have ALS. And I literally parked. I don't know why I did this, but I parked in the same spot that I arrived at the hospital in for the first time when I heard this before I went in for my very first neurological exam. Mind you, neurological exams are like they're just people looking at you, so it's almost it's scary because it's just like you didn't know that these were things that you could be having for so long, and you're just not showing signs of them. And so like they're tests that are just somebody looks at you and tells you to make rapid movements like this. I tell you like this. You tap 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 tap. You can you do this? Tap 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 tap. Can you do this? It's all about the width. Can like this, right? You just go like this. They want to see this. They want to see how big the gate is and how fast you can do it, right? You do both sides. You do this. They'll have you maybe do it like that. You go like that. They'll have you, they want to see hand opens, right? Um, Postural tremor. They'll have you put your hands like this. They'll wait. Put your hands out like this. They'll wait to see if your hand starts to go whoa, whoa, like that. You do toe taps. So put your foot down and you tap tap tap. It's the same thing as with the fingers, right? Um, and then they will test your reflexes. They'll do all these things, right? And you're just like it's a clinical test, so it always feels like it's never really set in stone because it feels like things can change. And of course, things can change with an actual test of blood work and whatnot. I get that. It's just scary because you're just like, what if I'm good today and I'm really bad tomorrow, right? So, um, it was really good, and I was really grateful. I went to my PT, and my PT did something called a Babinski. It's called a Babinski sign, and what they do is they take your foot, um, they take your foot here, okay, and they run a tool. It's just any kind of tool. I think it's like a blunt tool of just anything, and I think it's either on the outside of the foot or on the inside. And what they do is um, they do it, and what's supposed to happen is as they run it across a certain pathway, your toes as an adult are supposed to go down. If you're a baby or you're newborn, naturally the baby's toes go up and they flare out. That's normal. For an adult, it's supposed to go down. Well, my left side went down. My right side, my right side didn't do anything. Now, when I say like I've had an issue in my heel, plantar fascia, which is these are like literally shoes made to like support the fascia right here, the arch. In my Achilles here, literally like almost the entire Achilles into my calf up here, right up here, like here, really bad, into my thigh on the underside. Then it's onto my low back and my glute. Well, there when he did it here, there was nothing that happened. So there was no movement. It didn't go up because what happens is a positive sign for this means that when they run the length or whatever pathway they do it, the big toe will go up and the other four toes will fan out, and that means that um, you have an upper motor neuron lesion, something in the brain or in the spinal cord. There is a lesion. Well, I've had an MRI of my brain and I've had an MRI of my neck, and I don't show any lesions. And so my PT, he just said I'm just confirming with him. He said the left side was negative, the right side didn't show any movement. And so as I looked it up, it said, well, if in adults, it's normal to have the foot go down or to not show any movement. But a positive sign would be something that the big toe would flare up. So they'd be like this, it would go up, and the other toes would go out. And if you have something like that, then it's something's either damaged in the motor neuron pathways, um, and those point towards more of something that's going on in the brain or the spinal cord. So like MS, ALS. And so I kept asking Chat GPT. I was like, I don't understand. Like if I have a clean MRI, meaning I don't show anything structurally wrong. I don't show any masts. I don't show any damage. I don't show anything. And I don't have a confirmed Babinski sign, but my neurologist should have checked this. My PT did it. He just said, you don't have any movement. And I'm not sure if that's because my foot is just super jacked up. I don't know. Um, but that's it was like counter evidence is to say like if you have this you would see it elsewhere, and you would for sure see it elsewhere on your brain, on an MRI of your brain, and you would also have issue in your neural exam as well. And I had a clean neural exam. I had everything came back clean when I did it, right? Things have changed since then, but it hasn't been like, I don't know. I don't know if things can change drastically from just a month, from 2 months to when I did it to when I am now. I don't know. um so he said, "Hey, just go see a neurosurgeon." He asked me if I should go. He recommended a neurosurgeon to just take a look at my brain though and my neck, structurally, to make sure that there's something not there that's contributing. And the reason why he said that is because your neurologist can look at these things, but I'm not sure if they're looking at the actual pictures and they're listening to what the radiologist is saying. He said, but give it to a neurosurgeon because it's like a second opinion, but not necessarily. It's just to have somebody take a look at you structurally to make sure you're good, and to just actually show you the pictures so you can see, and they can kind of just follow up. So, and then he said, just mention the possible. He said possible Babinski sign, and so I don't know if that I don't know if I could even have that plus have something going on, if there's something going on in my neck or my brain, if my MRIs came back clean, because that's what they would look for. If you had this in an exam, they would then tell you if you failed any of this, even the finger to nose. Like when you do finger to nose, that's a part of the exam. You go finger. Sometimes you'll do it slow. They'll move it, right? And they want to see if there's any like wiggle, like you can't like you're having an issue, right? Um, That's the same thing with the thing with this. When people do this, right? Or they have you do this, because these are tied to sensory stuff here. Like every finger ties to a different kind of nerve, how the brain works. It's wild. Even the feet, how they would do a reflex, they test your reflexes, they kick your reflexes, they'd see if there was any something going on. Um, and it was like, okay, man. So I'm gonna go see a neurosurgeon on Tuesday, and I'm praying that he will just run through this stuff and he will take a look at me. Maybe he wants to just do a small neural exams are incredibly fast. They are not hard. They are not long. They take maybe less than 15 minutes and you're done, just depending on what they see or how many times they need to do something. Um, but I feel like I'm close to an answer. I'm still not diagnosed with anything. I have no idea what's going on. Um, I feel like I had the best news ever, and I feel like I had answered prayer. And I feel like I kept hearing the Lord say, "You don't have Parkinson's, you don't have ALS." Even if I'm experiencing all these symptoms, you don't have it. So I'm still standing on that word, and I feel like that word has come to pass again. And I'd ask that you pray for me as I reach out to a neurosurgeon to have a look at me, like literally look at my spine and talk about it. Like, hey, could this be causing some issue? Maybe, maybe not. My chiropractor said that it could be, but it's not necessarily indicative because it just feels like it's very mild. All the things you have are mild. They are common, and they're if you had an issue, you would also possibly see other issues, or you should have other things going on. And that's just it's kind of it's a great thing to hear that. It's just you since you don't have a diagnosis, you just are living in an unknown. And I've just been praying for an answer. And I've been praying that if it really is like long COVID or something, then okay, hey, I'm fine with that. If it really is something that's for a season, I'm okay with that. What I've been doing this entire time, and I believe what the Lord is teaching me, is that I have been literally clinging to his robe, like the woman who has been dealing something for 12 years. It has felt like the longest 3 months of my life, and I'm just reaching for the hem of the garment of Jesus, even though I'm a son of God and I am in the throne room. I am an heir. Okay. And maybe that's just what I mean. There's something he's teaching me, and I'm learning to be solely dependent on a miracle because I don't know what else to do. And my symptoms are here one day, gone the next, here another day, feel worse, then feel less, then don't feel anything at all. And that's not indicative of something serious. So it's indicative of something that would be health anxiety or something that is short term. I don't know. I don't know. But what I'm here to tell you is I'm asking for prayer to have a when I see the neurosurgeon that he would put some of this stuff to rest, and he would even do his own examination and just say you're good, like you're good, and what you may be experiencing is this or this. And I had a lady on the phone when I spoke with the neurosurgeon office. She was like, the way that she has a neurodegenerative disease, but after years of searching and dealing with something, she she did genetic testing. That's how she found out what she had. And I was like, man, but it was like the first person I actually talked to that like had felt like the same struggle, somebody who's worked out all their life. Her and her husband have worked out, and they know like the understanding of the mind to body connection. They know when something feels off, when something feels weird, it doesn't feel right. um and she has something called dystonia. And I just, I felt so bad. But she was like, I'm not trying to overshadow you. I'm just trying to empathize with you, let you know that I understand that you are advocating for yourself. And second opinions are not dirty words. And you should continue to look and continue to see until we have something that's more satisfactory. And it's not because nobody's doing their best work or their best job. It's just that have we exhausted every option and have we really narrowed it down? And I don't know just yet. I don't have that confidence just yet. Um, but I feel like we are. My friend Jared said this. He was like, I feel like we're on the end of a story, and however the Lord's bringing you through. So if you could be praying for that, that's next Tuesday. And I really hope and pray that this goes so well. And I really pray that it's a culmination of what the Holy Spirit has been telling me, and really an affirmation of the report after the report after the report, even if um, I haven't felt well at some point, or still feel these things, um, because uh, I'm reaching for all kinds of answers, and I'm happy to get the answers I do. It's just, you know, I don't want to make I want to make sure that I'm really questioning, and that yeah, I'm really getting the right answers. So and that I'm not leaving something on the table. And today's been a better day for me. It really has. My leg has been super quiet today, which has been great. And that's something that if you had Parkinson's, it wouldn't happen. It would always happen. Even in the early stages, it would always happen. So it's like, okay, yeah. So I know I've built a super huge fear around the movement disorders, especially Parkinson's. I didn't really think I had ALS, but as I dug into it and started thinking of all the symptoms, like maybe I do. And supposedly I don't. I don't know if I have an actual Babinski sign. Um, I don't think I do. I don't think I would have that if I was. I think you would show elsewhere, and that's everything I've looked up. If you had this, you would see other places that would have been affected. I've done the MRI of my brain and of my spine. and they show like some things, but they don't show like lesions. Everything looks good. Okay. So if we've done an MRI, then that's it. So anyways, guys, that's video. I'll see you in the next one.